Welcome to the Center for Healthy Communities series, It's Lit, Learning, Information, and Teaching. In our series, we break down relevant health concepts for our viewers. My name is Voong, and as a CHC intern, I will be going over menstrual health disparities among homeless populations facing period poverty. Let's start off with a few questions. Do you know what a period is? Have you ever had one? And do you know anyone who has had their period? Most likely, you have answered yes to any one of these questions, if not multiple. But just in case you missed it, according to the Cleveland Clinic, periods, also known as menstruation, are defined by the periodic shedding of the lining of the uterus and is an essential part of the female reproductive system. Sound familiar? Yet as common and natural as periods are, period stigma still exists in our society today. Even the mention of periods might even have you shifting in your seat at this very moment. Keeping the conversations about periods private might seem like a harmless everyday occurrence. However, what happens when keeping silent about our periods prevent us from addressing a much bigger issue? When we close the conversation on periods in our daily lives, we close the conversation on issues such as period poverty. Period poverty is a lack of access to menstrual products, education, hygiene facilities, waste management, or a combination of these factors. As of 2021, period poverty affects an estimated 500 million people worldwide. In the US alone, 17 million people who menstruate are in poverty. And as of 2019, out of the 568,000 people living unhoused, 38% of this population were women. Every day, these menstruators face the unimaginable dilemma of choosing food and necessities over menstrual supplies. Those who live unhoused often have to resort to rags, newspapers, and anything they can find as a substitute. So why aren't we talking about this more? Period poverty is more than just simply inaccessibility to period products. It's the disparities that women face in their health and well-being as a result. Period products are necessary tools for women to manage their periods. Those without these necessities face menstrual health disparities, which include susceptibility to conditions related to menstrual hygiene, such as reproductive and urinary infections. Not to mention the mental toll that menstruators in period poverty face every single month. So what can we do as part of our community to support the menstruators in need? Well, the first step starts with you. Open up the conversation. Start talking about periods to your mom, your sisters, your friends, and anyone who will listen. Educate others who don't have their periods. You have the power to lead these conversations and create an open environment in which periods are no longer a shameful topic. Advocate for others and do your part addressing these disparities on a local level. Seek out organizations in your community serving menstruators in need, including unhoused populations. You have the capability to make a difference in the lives of those living in poverty by taking action. Rally others to help provide period products, promote body-positive health education, and raise awareness of the issue. And finally, help build a future in which we can work together to ensure that all menstruators have access to the resources and support they need. Speak up. Speak up to your policymakers, community leaders, and health professionals. And together, we can uplift the well-being of menstruators living in period poverty and amplify their voices so that they can live much healthier lives. Thank you for watching, and please subscribe to the Center for Healthy Communities YouTube channel to learn more.